Thanks so much, everyone, for joining us. We will give it just a couple of minutes for folks to trickle in. Thank you so much for joining Fair Share America, Groundwork Collaborative, Indivisible, People's Action, and Protect Our Care for Over the Healthcare Cliff, Skyrocketing Premiums for Families Across the U.S. My name is Elizabeth Pancotti, and I'm the Managing Director of Policy and Advocacy at the Groundwork Collaborative. We are now 33 days into the government shutdown. As of this past Saturday, millions of families are facing the reality of, in many cases, doubling or worse healthcare premiums. As a result of the Trump administration, millions more saw temporary lapses in their food assistance benefits over the weekend. And while the administration has, as of just a few hours ago, promised to pay half of SNAP benefits this month, millions of American families continue to grapple with the higher costs across the board, despite Trump's campaign to lower prices on day one. As the government shutdown and open enrollment rage on, it's critical now, more than ever, that we reaffirm our efforts to reopen the government, lower healthcare costs for nearly 25 million Americans, and safeguard the vital community resources that the Trump administration has spent nearly the past year attempting to gut and undermine. We're so happy to welcome Congressman Boyle today to lay out the stakes of this moment and the fight that we are all in together. Congressman Brendan Boyle was born and raised in the city of Philadelphia. The son of an immigrant, Congressman Boyle's father was a janitor for SEPTA and his mother was a school crossing guard. The first in his family to attend college, he attended the University of Notre Dame, go Irish, and he was elected to the Pennsylvania state legislature in 2008, becoming the first Democrat to ever represent his district. In 2014, Congressman Boyle was elected to Congress, and now in his sixth term, Congressman Boyle is the ranking member of the House Budget Committee, where he's helped lead the fight against the Republican budget law. Thank you so much for joining us today, Congressman Boyle. Over to you.
Yeah, well, thank you, Liz, for that kind introduction and everything that you and the team at Groundwork do to stand up for the American people, especially in this difficult moment. It's also great to be on with friends from Indivisible, Move On, Protect Our Care, People's Action, and Fair Share America. You are the ones who are doing the really hard work, organizing, educating, and making sure people know what is happening with their health care as open enrollment now begins in all 50 states. So when open enrollment began 2 days ago, families should have started being able to focus on getting affordable coverage for next year. Instead, millions of Americans are now forced to choose. They're forced to choose whether or not they will be able to continue with their care in light of the fact they may be paying double or even triple for their health insurance. That is not an accident. It is not some freak natural disaster or some random event. It is because of a choice. And it is a choice that Republicans in Washington, D.C. made. So I would remind everyone about a bill that was passed 4 months ago and signed into law on the 4th of July in a big White House ceremony that none of us were invited to. When President Trump was signing that tax bill, the big ugly law, included in there as the centerpiece was tax breaks to the tune of over $5 trillion that mostly go to the top 1%. How are those tax breaks paid for? By the largest healthcare cuts in American history. Congressional Budget Office estimates more than 15 million Americans will lose their health care altogether. And then for tens of millions more who are able to still keep their health care, the cost will skyrocket. So hopefully you saw, but if not, I want to make sure you're aware of this information. A nonpartisan organization, the Kaiser Family Foundation, came out with a report. And they estimated that for the 22 million Americans who have healthcare tax credits, their health insurance is about to go up on average by 114%. Here in Pennsylvania, it's not quite as bad. We're only looking at an increase of 102%. So roughly speaking, a family that may have been paying $500 a month for coverage until recently now is looking at that more than doubling to over $1,000 a month. It's disgraceful. It is unconscionable. And why? All so we can provide more tax breaks for the people in society who need it the least. Now, those of us on my side of the aisle, on the Democratic side of the aisle in Congress, are fighting to attempt to reverse this damage to our health care. Rather than engaging with us in that conversation, or God forbid, a negotiation, what has Speaker Mike Johnson and congressional Republicans chosen to do? Shut down the government, including, by the way, shutting down the Congress of the United States. This is the sixth consecutive week the House of Representatives has not had session. It is absolutely remarkable, unconscionable, and a lot of other words that I could say that would be a little more salty than that Mike Johnson has decided to just totally shut down the House of Representatives rather than enable us to actually do this work on behalf of the American people to get healthcare costs back in an affordable range again. Now, my colleagues and I on the Budget Committee, that is the Democratic side of the aisle of the Budget Committee, working with my outstanding staff, we put together a tool so that people could better understand the ramifications of this healthcare crisis. We've called it our healthcare dashboard. It shows by individual district how many people are being hurt by the Republican plan, by name, by number, and by cost. So, and it's a little bit of a long web address, so forgive us. But if you go to boyle.house.gov/healthcare crisis, again, that's boyle.house.gov/healthcare crisis, you can exactly see what the Republican healthcare crisis is doing exactly where you live. Because it's one thing to understand these numbers nationally, but it's another to understand what the actual effect in your home neighborhood or city will be. Thank you again for what you're doing, and thank you for inviting me. It is so important that we help get the word out about the Republican healthcare crisis, that this is not by accident. This is not the normal economic cycle. This is a choice that the Republican majority made in Congress to drive healthcare costs through the roof, all so they could provide tax breaks to billionaires. Thank you.
Thanks so much for that, Congressman Boyle, and thanks for joining us today. Now we'll move into a panel discussion from two excellent panelists. Today we have Andrew O'Neill, the National Advocacy Director at Indivisible, where he leads Indivisible's advocacy strategy at the federal and state level. Prior to joining Indivisible, he worked for Congressman Mark Pocan of Wisconsin, his home state, where he covered labor and economic policy. In addition to Andrew, we'll be joined by Ann Schaup, the Senior Advisor for Strategic Planning and Projects at Protect Our Care. Ann cut her teeth in healthcare communications and advocacy at groups like the Center for American Progress and American Bridge 21st Century. Ann has worked with national and local organizations on strategic communications and has trained hundreds of policy experts and progressive activists, giving them the tools to craft their own message. Thank you so much for joining us today, Andrew and Ann. I want to get started with a question to just kind of set the stakes of this particular moment. And so, Ann, I'd love to ask you, we are now on the other side of the healthcare cliff. As of this weekend, folks could log into healthcare.gov or their state marketplace exchanges, see what they're going to be paying for healthcare premiums, and in fact, select their plans, not just kind of a window shopping exercise. I want to take a little bit of a step back and explain what the healthcare cliff is and how we got here. So I'll throw it over to you.
Yeah, well, first of all, thank you so much for putting this together. Thank you so much for having me. And you already started to lay the groundwork here as well as the congressman. So we have a little bit of background, but to take a step back even further. So these tax credits were they help people who purchase insurance on their own to help it become more affordable for low and middle income families. So the enhanced tax credits were expanded during the pandemic. We wanted to make sure that during this horrible public health crisis that as many people had coverage as possible. It was a hugely successful program, and so it was extended. But now we're at the point where Republicans are ripping it away, and all of those people who got affordable coverage through the ACA are now logging on to the new reality of their as the congressman said, skyrocketing prices. People are seeing their premiums double and triple. And I just to emphasize a point that was made by the congressman, during the big ugly bill that passed over the summer, during that fight, we raised the alarm, others raised the alarm that this was going to happen. It is a tax bill. The reconciliation bill that they passed is a tax bill. They were able to make tax cuts for billionaires and millionaires permanent, but they weren't able to do anything about these tax credits that help low and middle income families afford the care that they need. And so, a lot of the horrible things that happen in that tax bill, $1 trillion cuts to Medicaid, and to healthcare, including a lot of that is going to be the impacts on Medicaid. We won't see the impacts of that quite yet. They'll be starting to go into effect over the coming years, but these tax credits are happening now. As you said, people are logging on starting this past Saturday on November 1st. People were able to go log on to the websites, and this is open enrollment. So they're seeing their bills double, triple, and that will all take into effect on January 1st unless something's done. And this is entirely a crisis of the Republicans' own making. If we go back to 1 year ago, more people were covered than ever. And that was in part due to some states expanding Medicaid, but also these more generous tax credits and all of the hard work that was done by advocates pundits and navigators and advertising to let people know that a majority of people could get coverage for less than $10 a month. So all of that progress that was made, obviously in our imperfect healthcare system, I know it has a lot of flaws, but instead of working to make it better and working to ensure that everybody has the coverage they need, we're at this point where we are, fighting to protect against all of the destruction that has come from the Republicans. And again, this is a crisis of their own making. And so that's kind of where we are today.
Thanks so much for that overview, Anne. I just want to put a couple of numbers on these and go through some examples to really show how dire this crisis is. A single individual who makes $32,000 a year will see their monthly healthcare premium rise from $58 a month to $180 a month, which is an annual increase of about $1,500 a year. A couple who makes $44,000 will see their premiums rise from $85 to $253, about $2,000 a year. And a family of four making $66,000 will see their premium go from $120 per month to $375 per month on average. That is $3,000 a year. For all of these families and for all of those in between or facing even higher increases, this is not a matter of finding pennies in the couch cushion or not going to see grandma on family vacation. This is an additional car payment, an additional utility bill. The stakes here are really dire. And Andrew, I would love to throw it over to you. We know that these effects will not be felt the same by everyone across the country. And so which communities are we seeing hit the hardest by these premium increases and the broader funding cuts to healthcare that the Trump administration is undertaking?
Yeah, thank you, Liz, and thanks so much for having me. Look, it's families who are already struggling to get by are the folks who are going to be hit the hardest here. As you said in your opening, and as Congressman Boyle mentioned, Republicans really have done nothing to address the already high cost of living, other than to make it further skyrocket, right? Whether it's chaotic tariff policies or the big ugly bills, health cuts, or forcing hospital closures, canceling cheap energy projects so that our utility bills get jacked up, right? It's this very same people struggling to deal with those costs that are facing the premium increases. I would also note that it's a lot of younger adults in particular that are going to be impacted by the premium increases. The Urban Institute did a study that said the number of uninsured 19 to 34-year-olds would rise by 25% without these tax credits. So it's a bunch of young adults who are bearing the brunt of this. Another really important point to pull out here, and the Kaiser Family Foundation did an analysis on this, most of the folks who rely on ACA plans live in states that Donald Trump won in 2024. A lot of this has to do with the fact that many of those states have not expanded Medicaid. Therefore, people have to rely more on the exchanges. But 77% of ACA plan enrollees live in states that Donald Trump won in 2024. So they're screwing over young people, they're screwing over families reeling from Trump's economic chaos, and they're screwing over constituents in states that Trump won. So look, I think I care deeply, and everyone here cares deeply about meeting folks' material needs and building a vision of universal healthcare. We need to fight and win that. I also care about winning the power to achieve those things. And so to do that, we are really going to have to make it clear to those communities that the policies coming from this governing majority are harming them directly, and not just harming them, but harming them disproportionately. It's a direct attack on these communities.
Liz, can I also jump in and say that Andrew's absolutely right about all of those stats, and it is crazy to see. But other people who are really impacted by this are people with chronic illnesses or people like cancer survivors. Yeah, I was just on the Hill last week with someone who came in to tell her story, and she's not too far from the Congressman Boyle's district, but over in Lancaster, PA, and she's type 1 diabetic, and she's in her 50s, and she absolutely needs to have health care because her medicine is like water. She cannot survive without it. So there are certain people, I've talked to people, other diabetics, cancer survivors who they can't go without care. So what are they going to do? how are they going to make ends meet? Because like you said, it's like an extra car payment. It's like an extra mortgage at a time when prices are going up across the board. So, Republicans are trying to act like this isn't going to, impact people. And this is just like a Democratic talking point, but the impacts are real. And when you go into the storytellers, the type of people that we're talking about, you can see small business owners are another really group this is going to hit hard, because these are people, who don't have employer-based coverage. They have to provide coverage themselves. So, these are people that are really going to be impacted. And that's not who you're hearing Donald Trump and Speaker Johnson talk about. They're not telling these stories of the 60-year-old substitute teacher in Tampa who doesn't know if she's going to afford her insurance next year, or the woman there was a woman, Jody, in Atlanta, who is trying to get a surgery right now before the new year, because she doesn't know if she can have coverage next year. So those are the four stories we're trying to focus on, because those are the people who will be impacted the most.
You're exactly right. And telling those stories is such a powerful part of this, being able to tell the story of your neighbor, your community member, your own family member who will be affected by this, you yourself. And I just wanted to piggyback off of something you said. Half of adults who have ACA marketplace coverage are either small business owners or employees of small businesses. And more than half of recipients of ACA premium subsidies live in districts represented by Republicans, all of whom are right now refusing to extend these subsidies to help their own constituents. I want to shift gears a little bit and talk about kind of what the landscape of this has been in the real world. Awareness of the government shutdown has continued to rise and is now at nearly 90% of voters. There are very few things that are able to break through to 90% of the American public these days, even with the day-to-day chaos of the Trump administration. And so, Andrew, I would love to know how we can effectively explain to Americans why the government is shut down and what Democrats are fighting for right now as they, continue to hold leverage over this fight.
It's a great question, Liz, and I do think that we should not take for granted, actually, that we are at 90% awareness already, right? That took active work from a lot of folks who are here on this call and who have been doing work out in communities across the country, both in the lead up to this government funding deadline and throughout the last 33 days. So look, there's a couple things here. One, obviously, we got to continue to be really clear and simple in our messaging. Republicans are keeping the government shut down rather than stopping healthcare price hikes for more than 22 million Americans. Layering in these personal stories is really critical. Anne shared some great ones. Obviously, the most important thing you can do is to personalize it, either to yourself or to whatever audience you're speaking with. I think also positioning this in the context of this broader affordability crisis, right? Everyday families are watching prices rise and they want Congress to do something about it. That is the thing that breaks through in just about every poll on every issue that any polling outfit has done over the course of this year. And this fits really squarely into that. Healthcare prices are a huge part of a family's budget. Another thing to remind folks of is who is in control here, right? Donald Trump is posting on Truth Social that Democrats ought to do something, right? But Republicans control Congress and the White House, and they both have the power and the responsibility to end this shutdown. And that's going to require being adults and doing their job and coming to the negotiating table. I'd also say, so that's on the messaging front. I'd also say that you can't and we can't assume that the public's going to receive thoughtful, comprehensive coverage of what's going on just organically, right? That's just not the information environment that we live in. And so all of us have a role to play in piercing those various information bubbles all around us. With the exception maybe of our friend Congressman Boyle, you're probably not going to get interviewed on Fox or the Joe Rogan Experience. But whether it's talking directly with your neighbors, sharing those personal stories, building an art installation in your town to draw attention to this, or organizing a mutual aid event in your community, these are really tangible ways that you can pierce those bubbles while also, doing some good.
Thanks so much for that, Andrew. I know that this awareness figure is very startlingly high. Just to put that into context, we hit a ceiling of about 50% of Americans who were aware of the Republican budget law over the summer. And so we have really been able to break through on this government shutdown and the fight over healthcare. I want to highlight too that in addition to knowing about what's going on, voters are very aware of who is responsible for the healthcare price hikes that are now pummeling Americans. Republicans are blamed by a 17-point margin for rising health insurance premiums, and they have reaffirmed over and over in our polling and in other polls from other outlets that they blame Republicans for the government shutdown and for rising healthcare costs. And the most effective message is one that ties those two things together. It is very easy to get distracted by, the East Wing demolition and other chaos that the Republicans in Washington are sowing, but staying on message is really the most effective way. To that end, still on the topic of staying on message, we know that Trump is threatening to drive up families' grocery bills by withholding funds from food assistance through SNAP. We know that today the administration announced they will pay for half of November's SNAP benefits as the government shut down wages on, even though they have funds available to them to pay for the whole thing. But how can we respond to these threats, whether it's SNAP today or Trump's pet project tomorrow, while keeping the focus on the healthcare message? Andrew, I'll go to you first.
Yeah, thanks, Liz. Look, I think we'll take away your food unless you let us take away your healthcare is not a particularly defensible position. And the rest of us are saying no one should have to choose between food and healthcare. And so I think that's a line I would encourage people to take here. Another thing is that most people out across the country aren't tracking the specific legislative mechanisms here, right? So if explaining those things to them is helpful for your particular audience, that, great. I love getting into the weeds. If people want to talk about the difference between, a lapse in funding from the shutdown versus the expiration of a tax credit, I'm there for that conversation. But in most cases, it's best to just remind people who's in charge and who's inflicting the pain. And then again, to bring it back to that, to those personal stories. I think we often psych ourselves out kind of in the DC bubble of like, oh, how are we going to talk about two issues at the same time? But really, this is about how people are caring for themselves and their families. And healthcare and food are about as basic as it gets for them.
Yeah, and I agree with that, and I think that it's interesting because I think typically Trump does an amazing job at being able to, set people's focus on what he wants. But when they were doing a lot of the scapegoating on this issue and talking about fraud and who gets these benefits, that didn't really seem to work at all. And they've almost moved on from that message for the most part. I would encourage people not to get too hung up on those lies, and because we have such a winning message and people really are with us on this. So just kind of stay strong on your message. But it is, what they were saying about these programs isn't true. And so there are definitely facts and figures if you want to reference them. But I think just really staying super focused on our message and bringing it back to healthcare and not getting too spun up on the lies that are being told and really focusing on the people because they have no answer to that. I think two things, focusing on the doubling and tripling and sometimes quadrupling of premiums, they don't have an answer for that. The numbers are there. And then, focusing on the people because they're acting like there are no impacts to Americans. And, we have so many stories of people who aren't going to be able to afford care. Also focusing on the urgency of this issue. We've heard a lot from Speaker Johnson of like, oh, we'll open up the government and we'll talk about this. This is an issue for the end of the year. That's simply not true. People are logging on right now to see what their healthcare premiums will be for next year. And so this is a problem for right now. We can fix it, but it requires the Republicans coming to the table and actually talking to Democrats and negotiating and ending their crisis.
I think that's such a good point. And we have seen Republicans across the board say, reopen the government, we'll come to the table. This is not an issue that can be solved by an end of year bill at the stroke of midnight on New Year's Eve. This is really an issue that people are facing currently. And The Congressional Budget Office found that even if Congress were to extend these subsidies, that for many Americans, they will either still forego care, choose a worse health insurance option as a result of logging in, seeing these sky-high bills, and being scared off. In addition to that, we have also seen rising premium costs, kind of the sticker price, regardless of what the ultimate price that people pay is, depending on if these subsidies get extended, that sticker price has gone up. And about a third of that has been driven by Trump's tariffs and the lack of extension of these subsidies. Right now, they are forecasted to increase by about 20%, according to the Kaiser Family Foundation. And then on the employer-sponsored insurance side, which provides healthcare for about 170 million Americans, we are also seeing, decade-high increases in premiums. So the fight over healthcare obviously does not stop with the extension of these premium tax credits. Our healthcare system has been and is still facing deeper ongoing crises. So, Anne, looking ahead, how can centering healthcare in the shutdown debate help broaden the conversation and put it back at the heart of our national political agenda?
Yeah, well, you set that up really well. And unfortunately, if no changes are made here, people are really going to be hurting when it comes to healthcare over the next few years. There were devastating cuts to Medicaid in the big ugly bill that'll be taking effect. And with these premium tax credits, millions of people, if they end, millions of people will lose their coverage, will decide not to purchase insurance on their own. And so, what's going to happen here is, and this is an important point of what to emphasize too. This is going to impact everybody. A lot of people might be just tuning into this, for awareness, and they might think, oh, well, I'm not on Medicaid. I don't purchase insurance on my own. But this will really impact all of us. Like you said, premium prices are going to go up for everyone. As more people choose to not be part of the system, younger, healthier people will decide to forego healthcare. That will change the math for these insurance companies. They're going to raise premiums for everyone. As more people go into hospitals who don't have coverage, it's going to increase uncompensated care. And so that changes, the hospitals are working on really tight margins, and they're already looking ahead and saying like, well, wait a minute, if all these people are going to lose their coverage, we're not going to be able to make our numbers work. So they're already announcing cuts to services or closing entirely. Protect Our Care started a project over the summer, right when the big ugly bill passed, where it's called Hospital Crisis Watch, and we have a map where we're tracking all of the hospitals that are at risk or who have announced, clinics closing, services closing, hospitals closing. And we already have, I think, around 600 items on that map. And so my point being, to circle back to your question, people are going to start to really feel these impacts, and they might see a local news story about their maternity ward at their local hospital closing, or longer waits at doctors' offices, and they're gonna that's gonna upset them, but they might not necessarily connect that to these larger decisions that are being made. And I think Congressman Boyle talked about this a little bit too, of we really need to connect what is happening on a local level and what people are seeing and what they're feeling to what's going on nationally, and let them know who's on their side, why this is happening, who's to blame, and so that we can really hold the politicians that are doing this accountable and work to protect what we have and try to reverse some of these damage and some of the damage that's been done. I also think that building this narrative nationally of pulling out all these stories of look at all these hospitals closing around the country, look at all of this pain that's being caused, look at all these small businesses that are closing because people can't afford to cover themselves or their employees, and really connecting that to this national narrative and making sure that story isn't lost nationally. So it kind of making sure it goes both ways there, I think is going to be important work, and really telling these stories over the coming years and unfortunately months, because I think that we will start to see these Medicaid cuts hit too, and that'll be a problem as well.
That's completely right. With nearly 500 million rural hospitals at risk of closing, some have already shuttered their doors, even in anticipation of the Republican budget laws cuts going into effect. We know that this fight is today's fight, but is not the only fight in healthcare. Andrew, we've covered a lot about what's at stake and how communities are being affected. And for those listening who want to turn this information into action, what should they be doing right now? How can people keep up the drumbeat on healthcare, whether it's the ACA fight, the Medicaid cuts that are coming down the pike, or just the fact that healthcare prices are rising across the board?
Absolutely. And keeping the drumbeat up is the right way to frame that. We really got to increase that public awareness. They know that there is a government shutdown, but we can do more to make sure that people know what's at stake for healthcare and what they can do about it. So number one is to engage your members of Congress, right? Calling them, emailing them, meeting with their offices. Engage them in the fight for affordable coverage and make sure that they, don't bypass this opportunity to bank a healthcare win for the rest of us, right? Especially if you have a Republican member of Congress, they're going to need to hear from you, right? They need to know that that you're tracking this, that you know who is to blame for the rising healthcare costs either right now or next year, and share your personal stories, right? And especially if they are a member of the House, maybe tell them to get back to DC and start doing their job rather than just taking what might become a record-setting, congressional recess while we're staring down these cost increases. And then if you have a Democratic senator, other than a couple, you should be thanking them for holding the line and telling them that you expect them to keep up this fight for healthcare, right? That you believe that this is urgent and that this is winnable and that you're relying on them to do this. I think we'll share in the follow-up here a toolkit that Indivisible has with call scripts and email scripts and a bunch of other tools for you to take this sort of action. We make it really easy on you. And then the other thing that I would say, and we've referenced it a bunch, is sharing your personal stories, right? We need to make this a human impact story rather than a story about process and congressional negotiations. And this is really where we're appealing to members of Congress as human beings, right? Republicans in Congress have been hoping that Democrats would cave before the full impact hit. And now that people are seeing these cost increases, we need to use those stories to hold their feet to the fire and demand that they act, right? Demand they get back to town, demand that they start negotiating, and demand that they do their job to prevent this harm. And this can be super simple. If you got a notice from your insurer, you can black out any personal data and post that picture to social media. I've seen folks using post your premiums as a great hashtag to use to get this out there. I think we've got a number of tools that we can share as well that will help you tell that story either via social media or with organizations that are actively collecting stories to then amplify them to media and to members of Congress. So those are the two pieces that I'll really encourage everyone to do. Engage with your member of Congress if you have not already. And if you think they've heard enough from you, they probably haven't. So make sure that you're still in their ear and in their inboxes. And then tell your personal story because that's really how we make this a fight about what we deserve and what our communities need rather than just a process fight.
Thanks so much for that, Andrew. I will say next time you call your mom, your grandma, your cousins, asking if they've logged on to see their healthcare premium increase and telling them who is to blame is so important. And asking people in your community so that you can both build community and highlight this issue. We'll now move into the Q&A. I know we have a number of submissions already, but as a reminder, folks, you can submit your questions at the bottom and we'll start selecting a couple. I want to kick off the first question for Anne. A participant says, I've heard that if this isn't reversed before open enrollment closes, the premium increases will not be able to be reversed. Can you explain kind of how all of this timing works, given that Congress has failed to act before that November 1st deadline?
Yeah, so it is complicated, and partially this is complicated because each state has a different system and how they do notices and different healthcare companies. I mean, look, we have a complicated healthcare system. I think we all can agree on that. We having participated in it ourselves. But basically we do have enough time to reverse this and to, to extend the tax credits to make them permanent is what we would argue should be done. And the insurance companies, I think, would be able to do that. And then even, if we get closer to the end of the year, things could be done to make this happen, have special enrollment periods, have fund navigators. I think the problem here is those are traditionally things that Republicans haven't wanted to do. During the pandemic, they didn't want to do special enrollment periods. They have cut funding for navigators who help people enroll in coverage. So, the easiest thing to do would be to, renew, because it's also been talked about that they could make changes. But I think a lot that would complicate things because all of these rates have been set. So the easiest thing to do would be to just, extend these tax credits, make them permanent, as is, and then that is something that can be done. But the closer we get to the end of the year, it gets really, really way more complicated and would involve things that traditionally Republicans wouldn't want to do, like, special enrollment periods and extending. And having more funds to make it easier for people to sign up. I will say, if you are someone who needs to sign up for coverage, first of all, or if someone in your life uses these purchases insurance on their own, definitely make sure they're not auto enrolled, because they should be, because a lot of people are. So they should go in and shop around and make sure that they're picking the right plan for them. And definitely make sure that their provider is still in network. If they're going down to, maybe from a silver plan to a bronze plan, they should make sure that their provider is still in network. And just check on the different levels of deductibles and if any medications would be covered. So there are things that you should be telling your family members to do. And then hopefully, like, log in now, look around, ask questions, and then hopefully these will be passed before the end of the year, so you can always check back in, and make final decisions later, or even edit your decisions later. But yeah, it's a complicated process, and sorry if that was a long-winded, not very clear answer, but can be done. Easier to do it now, and the Republicans don't seem willing to do the things that would need to be done to make this a smoother process.
I don't think will shock anyone that our healthcare system is complicated, and this makes it more complicated. But I think it is so critical to know that people can go back in and change their choices. So if you are logging in, if a family member or a community member is logging in now, making a choice that is a less good health insurance policy because you just simply can't afford the one that you had this year as a result of these subsidies. If the subsidies are extended, you can go back in until January 15th to make changes to your selections, which I think is so important that we get that message out there if these subsidies are extended. Andrew, I want to turn it over to you now. We have seen Republicans take up this talking point, and someone asked us in the chat, but what is keeping Republicans from blaming premium increases on the Affordable Care Act or on Democrats' policies itself? What are Democrats doing, or what can we do to really nip that message in the bud?
Well, what's stopping them from blaming Democrats? I guess is nothing, because they are blaming Democrats, despite the fact that that doesn't really make any sense. So look, I would say a few things here. One, as we talked about, Republicans had an opportunity to extend these tax credits earlier in the year. They passed a huge tax bill that did a lot to our healthcare system. And Democrats at the time and advocates were saying, hey, you should be extending these premium subsidies. You should be doing things to make healthcare more affordable. And they said, no, what is urgent is tax cuts for billionaires. What is not urgent is extending affordable healthcare coverage. So that's number one. Number two, Democrats have been very clear for a long time that they would like to extend these subsidies. There are multiple bills in Congress that would do so, and that's of course in addition to many Democratic proposals to continue to expand coverage, to bring Medicaid coverage to states that haven't expanded, and to do more to make our maybe needlessly complicated healthcare system simpler and easier to navigate. The other thing is, I would say that Republicans have really flubbed this particular messaging moment. You see Donald Trump saying, I want to cut a deal. We're ready to come forward with our own healthcare plan, right? I mean, unless someone has some breaking news here, the Republican healthcare plan is really nowhere to be found. They're not even, holding hearings saying, yeah, this is our alternate proposal. Here's how we're going to remake it, right? The only healthcare plan that they have is what they already did in the One Big Beautiful Bill, and that was not extend these premium subsidies and to rip Medicaid away from a ton of people and close a bunch of rural hospitals, right? That's their healthcare plan. And so I think, will they continue to lie about who is to blame for healthcare increases? Sure. Yeah, I think they probably will continue to lie about that. But I think we've got a really strong hand to play when it comes to debunking that and to pointing to really concrete ways that whether it's advocates or whether it's Democrats in Congress, what we would like to do to the healthcare system to make it simpler and significantly more affordable.
Thanks so much for that, Andrew. I think it is really worth highlighting that when Republicans had the chance to do a healthcare bill, they did in fact do one, and what they did was cut $1 trillion in funding for Medicaid. And so with that in mind, Anne, we have another question. I'm going to combine two of these, but can you explain the changes that are coming to Medicaid? It sounds like these changes to eligibility for Medicaid are not imminent, and is it all going to get worse when those changes go into effect?
Yeah, so these changes to Medicaid, are going to go into effect over the coming years, and a lot of the things that they're trying to do are, are to make it harder for people to enroll in coverage and to get their Medicaid coverage that they're eligible for and then stay on Medicaid. So, states are going to have these eligibility requirements. They're really truly paperwork requirements to make people who make it harder for people on Medicaid to stay on Medicaid. And of course, this is at a time when nobody can afford to not have this coverage. There's no other options, and so this would be devastating for people, and we would see things like rural hospitals closing, more uncompensated care, and this is truly a life and death issue for people. And it's really the talking points that you heard over the summer about people who are undeserving on Medicaid, or people who could work and were just choosing to be on Medicaid because we're having these work requirements. It's just simply like not true. Most people on Medicaid who can work do work. A lot of people are seniors, or children, are caretakers. And that's why they're not applying for jobs outside the in the workforce. But even even then, a lot of people who are on Medicaid do work. They are working in jobs, and unfortunately aren't getting a wage that is enough that would that make them eligible to not be on Medicaid. So it's unclear exactly what this is going to look like, because we're going to have to see how these work requirements are implemented and take effect. But we know in the states that have implemented work requirements before that they've been disastrous, in Arkansas and Georgia. So it's really something that we should be keeping our eye on as that process continues and they're implemented, because it will as we know from the past, it just keeps people who are eligible for Medicaid from getting the coverage that they deserve.
I know we have ample evidence of this from the first Trump administration, where Medicaid work requirements, really these paperwork requirements, were enacted and unfortunately resulted in so many folks losing care that they are eligible for. I want to shift gears a little bit here, and Andrew, throw it back to you. We know that the media landscape is changing rapidly. It seems like the best way to get news now for most Americans is through social media, which can have all sorts of issues. But how can we reach people who live in a completely different media environment, who think Democrats are to blame either for rising healthcare costs or just rising prices and their hardship in general? What breaks through, and how can we reach our community members?
Yeah, I mean, if there's anyone who is a TikTok influencer here joining us on this call, there's a really important role for you to be playing right now with that platform. But I think for most of us who don't have that, a few things, and some that we've already talked about, right? One is personalize it, take it out of the Democrats versus Republicans procedural story and talk about the human impact, you're going to have to do that in conversation with people in your community, right? That could be via social media. That could be, friends and family members who, you connect with on Facebook or Instagram or some other platform. But it might be in real life. It might be at the Thanksgiving table. It might be, at after church service, whatever that is. Connecting with people in real life means that you are between them and maybe the nearest screen, and that's an opportunity for you to break through directly. Another thing that I would say is, if you're trying to engage an audience of people, or maybe an individual person who believes that Democrats are to blame for all of this, that Donald Trump is doing everything he can to bring prices down, and they clearly have some misguided, misinterpretations, I guess, of our current situation. You don't need them in this moment to totally do a 180 on Donald Trump. You don't even really need them unless they happen to live in Brooklyn, maybe. You don't need them to like Hakeem Jeffries or Chuck Schumer, right? What you can do is say, what is our member of Congress doing? What is our senator doing? What are they saying should happen right now? And maybe what are they not doing to address this very, very acute and urgent human need? And I think that can help kind of break it out of the frame that is probably being fed to them by, a certain cable news program or, right-wing media ecosystem elsewhere. That you don't need to fight on that terrain because you're probably not going to be as loud. But what you can do is bring it back home, and talk about what your member of Congress is doing, and what your community needs.
Thanks so much for that, Andrew. We are almost at time here, so really want to throw it to each of you, Andrew and Anne, to just say the one thing that you hope people take away from this. I would say it is to talk to your family members around the Thanksgiving table, but I hope that we have solved this problem by the time we get to Thanksgiving here in a couple of weeks. But Anne, I'll start with you with just the most important takeaway for our listeners to walk away with from today.
Yeah, I think that to emphasize that this is a winning issue for us, that we should be talking about it. It's deeply personal. I'm saying a million things. This isn't like the one thing. It's a life and death issue for people. So as I'm doing this work, I'm hearing the anxiety in the voices of people who, tell their stories, that work with us, and I can just hear how nervous they are about how they're going to make ends meet this year. So, really thank you for all the work that you're doing, because you're helping us lift up this issue. And it's so important. I feel like after the last No Kings protest, it was kind of a jolt of energy in the healthcare space. So I just want to thank you all for this work, and keep it up, and really continue to tell these stories and advocate for people who really need this care the most, but really for all of us. So thank you.
I'll pick up right there, and obviously love the No Kings shout out. That was a big reason why we want to do those major mobilizations, right? Is to visibilize how many people are upset with what is going on, that we are not alone, and that we are not powerless. And I would say the same applies here to this fight, right? Republicans in Congress want us to believe that this is a fait accompli, right? These tax credits are expiring. We're not doing anything about it. You're going to have to deal with it. And we in fact, we've packed up and gone home, and we're not even in DC. And that is not the case, right? These are winnable fights, and taking them on matters. Telling your personal story matters. Being loud and in your member of Congress's ear matters, and it sends a signal to them directly, but also to their colleagues, and frankly to actors across society, that the Republican agenda here is not inevitable, and that they don't have a mandate for stuff that is causing direct harm to us. Right? These things are incredibly unpopular, and what they are hoping is that we kind of check out and don't pay attention and let it happen. But we have the power and the numbers on our side, and we just have to keep it up.
That's so important, Andrew. I think back to March, April, when the last government funding showdown was that got us to this point, and Democrat leaders decided to fund a continuing resolution to keep the government open. And I think the noise and the fight about all of this led us to this moment where leaders knew that they had to fight for this, and that the healthcare prices for millions of Americans were worth fighting for. Sharing your story, sharing your either personal impact, a family member's, a neighbor, a close community member is so powerful in contextualizing this fight and making people know that we are on the right side of this fight here. I want to thank everyone so much for joining us today and for continuing to be with us in this fight. And thank you so much to our co-host, Fair Share America, Indivisible, People's Action, and Protect Our Care for co-sponsoring today's event, and for Andrew and Ann and Congressman Boyle for joining us today. Thank you so much. Talk to you soon.